today? What's been going on?
I've been a little dizzy, really fatigued. I've been short of breath. That's what got me the most, is I feel like just walking up the stairs, I'm like wheezing, like trying to catch my breath. I also haven't, I don't know if this is relevant, but when I go to the restroom, like very little pee comes out.
Really?
Yeah, so I don't know if it's that, and it's just some confusion with that. So I feel confused.
So in like one day, do you generally go to the bathroom once, twice, 3 times?
Yeah, normally when I wake up in the morning, like I'll have to like pee, but when I wake up, it's like very little. It's like it doesn't want to come out or something. I don't know.
Okay, so we're gonna draw some labs on you and run them and just see if we can find out what's going on.
Okay.
So I'll be back in a little bit to do that.
Okay, thank you.
For our patient, the first lab we wanted to look at was the glomerular filtration rate, or GFR, because this shows us the most reliable indication of kidney function. So our patient's labs were down to 52, which is much below the normal range. We also took a look at our patient's serum creatinine levels, and these were elevated up to 2.6, which means that there was more creatinine in the blood because the kidneys weren't filtering it out as fast as they should be. Her blood urea nitrogen, or BUN levels, similar to creatinine, were elevated in the blood up to 25, and this also shows that there was a decrease in her overall kidney function. Another role of the kidney is to balance electrolyte levels in the body. So our patient's potassium level was very high because normally the kidney will excrete potassium, but in this case, too much of it was being left in the body because the kidneys weren't functioning at max capacity.
Hi Edith, we're back. So we were able to run your labs and we were really trying to look at your kidney function because we were worried about that. So we found that your GFR, which is just the rate that your kidneys filter through blood, was decreased. And because of that, your BUN, creatinine, which is just levels of different things in your blood that get increased when your kidney function slows, both of those were really increased also. So in addition to you're being dizzy and fatigued and not peeing very much and being short of breath, the doctor thinks you might have acute kidney injury.
What's acute kidney injury?
Acute kidney injury can be classified with 3 different types: pre-renal, intrarenal, or post-renal. The first possible cause of AKI is pre-renal. This is the most common cause of acute kidney injury, and it's related to inadequate kidney perfusion, which means a decrease in blood flow to the kidneys. It's a problem happening before you get to the kidneys. Poor perfusion can result from hypotension, hypovolemia, sepsis, inadequate cardiac output, or renal artery stenosis. Less blood is being delivered to the kidneys, meaning less blood is being filtered. This causes a decrease in the GFR. This can cause the kidneys to release renin, which causes retention of fluid and sodium to try and compensate for the decreased blood flow. It's important to monitor fluid and electrolyte levels in AKI patients.
Intrarenal is a problem within the kidneys themselves. It can be related to the glomerulus, tubules, or the cells within the kidney. Intrarenal injury can result from ischemic tubular necrosis, when the cells within the tubules die due to lack of blood. Usually this is due to a pre-renal injury like hypertension. Nephrotoxicity can cause tubular damage or necrosis. Contrast media, some antibiotics, and myoglobin from muscles are all things that can cause nephrotoxic cell injury or death. Inflammation, often a response to injury, within the glomerulus also further contributes to cell damage or death. Last but not least is postrenal injury. This is more rare and is related to problems downstream of the kidneys. It is most commonly caused from a urinary tract obstruction, meaning that there is something blocking excretion. Examples include benign prostatic hypertrophy, which is overgrowth of the prostate gland that can block the urethra, bilateral ureteral obstruction, tumors, or a neurogenic bladder are other causes of postrenal acute kidney injury. The obstruction causes a buildup of pressure in urine that backs up into the kidneys. This increase in pressure causes a decrease in the GFR.
Hi Edith, I'm back. So the doctor put in some orders for some medications. I'll be bringing those around soon. But I just wanted to talk to you about them first. So with your history of hypertension, it seems to have damaged some of the arteries around your kidneys, which is why it hasn't been getting enough blood flow to it, which is what caused the lower filtration rate in your acute kidney injury.
Is that why I haven't been able to like pee a lot?
Yeah, if the blood doesn't
Okay.
come through, it can't filter it out as much, which is why you haven't been able to produce much urine.
Okay.
So to help with that, we're putting you on Lasix. It's a diuretic. It's something that helps you urinate more because it makes more salt come out of your blood, and water follows salt. So it makes your blood volume go down and increases your urine output.
Okay.
So if your blood volume down, hopefully that'll control your hypertension, which then goes to increase your kidney function more. So we're going to start you on that Lasix and keep monitoring your kidney function for the next 3 to 6 months to see how it increases.
Okay.
Any questions?
No.
Okay.
So,
Be back
thank you.
soon.
So furosemide, or Lasix, is what was prescribed for our patient and is often the drug of choice to treat acute kidney injury. So Lasix works by inhibiting sodium and chloride resorption at the proximal and distal tubules in the ascending loops of Henle. This draws out water from your blood also, which increases your urine output and also decreases your overall blood volume. Lasix can be given orally, intramuscularly, or through an IV.
Other than loop diuretics like Lasix, other types of diuretics can also be prescribed to patients with acute kidney injury. Osmotic diuretics also increase urine production and work along the entire nephron. Osmotic diuretics increase oncotic pressure, which pulls water into the tubules and increases glomerular filtration. They can also be used to decrease intracranial pressure. It causes some vasodilation, and it can also be used to treat edema. One important nursing consideration for osmotic diuretics is that they may crystallize in low temperatures, and a filter needle should always be used for this drug. It is also important to monitor potassium levels in patients taking osmotic diuretics. Potassium-sparing diuretics are drugs that, like the name implies, spare potassium. These drugs can be used with a loop diuretic to counteract potassium loss. However, these drugs should not be used by themselves in acute kidney injury patients because they can cause hyperkalemia. Potassium-sparing diuretics are aldosterone antagonists and therefore cause vasodilation. This drug should not be used for extended periods of time because it can cause toxicity. Last but not least, thiazide diuretics can be used to decrease preload and afterload. They can cause electrolyte depletion, and to reiterate what we've said before, it is important to monitor fluid and electrolyte balances. These drugs have a ceiling effect, meaning that once the therapeutical level is reached, an increase in dose will have no effect. These drugs also have dilation properties and are sometimes combined with other drugs to treat hypertension as well.
So that was a lot of information, but hopefully now you have a better understanding of acute kidney injury. Other nursing considerations to keep in mind for our patient are to monitor intake and outtakes to check for fluid balance, monitor blood pressure and pulse rate, level of consciousness related to electrolyte balance, and prevent constipation related to drug diuretic use. If acute kidney injury is caught early and treated, kidney function can be restored to the patient. It may take a while for kidney function to return to normal, and it is important to continue to have your kidneys monitored once in remission.